Is it possible to have upper and lower eyelid surgery successfully without a general anesthetic? It's clear as day that I really need both upper and lower eyes done. Is it possible for them to be done successfully without a general anesthetic? I'm terrified of those. Secondly, is it better for the bottom lid to be done by cutting on the outside of the eye or on the inside of the eye?
Thank you for your question. You've submitted a photo that shows what appears to be upper eyelid extra skin as well as puffiness under the eye. And your question has two parts. One is regarding whether or not it's possible to do eyelid surgery without general anesthetic, and that you mentioned being terrified of general anesthesia. And two is whether or not it's better to do the lower eyelid surgery from the outside or the inside. Well, let me start by answering your first part of your question with an emphatic yes, it is possible to do upper and lower eyelid surgery without general anesthesia. Approximately 20 years ago when we started our practice, I became really committed to the idea of avoiding general anesthesia as much as possible for cosmetic surgery. At this point in our practice, we actually do everything, with the exception of complex rhinoplasties, where we do everything under local anesthesia with light sedation. You see, I realized during my training that much of the issues with the healing process and the recovery had to do more with recovering from general anesthesia than the actual surgery itself. So I made it my mission to prove that we can do upper and lower eyelid surgery as well as facelifting surgery under local anesthesia. So I appeared on several TV programs and I actually performed the surgery with the patient actually wide awake. So you can have eyelid surgery under local anesthesia, or in our practice we do everything under local anesthesia with light IV sedation. That means intravenous. You're not under general anesthesia. You have a tube, you avoid the tube in your throat, but rather you actually have just an IV or intravenous where you give low doses, get low doses of medication that relax you, but does not require that you have any type of breathing support. Now, as far as the other question about the lower eyelid surgery, it actually requires a physical exam, but I'll tell you a little bit about how I make the assessment in my practice. I've been a practicing cosmetic oculofacial plastic surgeon for 20 years, and so I can let you know what are the details that are important to me when I make an assessment. The first thing I question on whether or not to do the surgery from the outside or the inside is whether or not there appears to be extra skin. There is a lot of plastic surgeons, board-certified plastic surgeons, who get themselves in trouble because they fail to distinguish extra skin from skin quality or lack of skin quality. So it's a differentiation of quantity versus quality. When people complain that their skin looks crepey, or when they smile there's a lot of extra skin, a lot of well-meaning doctors will take away skin, and unfortunately that results very often in problems such as ectropion, where the eyelid everts out, or eyelid retraction, where the eyelid is pulled downward, or combinations of both. So determining whether or not there's extra skin, also determining the integrity of the muscle called the orbicularis muscle and the lateral canthal tendon, which is a tendon which supports the eyelid. A lot of times when I do this procedure, when there is a little bit of extra skin, I'll combine a transconjunctival approach, which is from the inside of the eyelid, with a skin pinch or removal of a small amount of skin. It's very important to understand that eyelid surgery is not about wrinkles. When we're dealing with the skin quality, we often do procedures such as fractional CO2 laser, platelet-rich plasma injection, which is using your own blood and using the growth factors that can be separated to stimulate your own body's collagen. You know, when you think about what causes reduction in skin quality and crepiness, it's loss of blood supply and collagen. So we've actually been very innovative in a way that to use platelet-rich plasma to help the skin quality. So I would say that making that decision does require a physical exam. The majority of the surgeries that I perform in lower eyelids, I do use the transconjunctival approach. Transconjunctival means going in from the inside to approach the issues of prolapsing fat and repositioning and things like that. If there is any laxity of the lateral canthal tendon, we do procedures such as the lateral tarsal strip, lateral canthoplasty, things to reinforce the position so the eyelid doesn't pull down. So, as far as the two questions are concerned, to summarize, you can do your procedure under local anesthesia or local anesthesia with light sedation and avoid general anesthesia, and I would really advocate for that. I feel like my patients recover a lot faster. We get most of our patients back to work in a week. And as far as the lower eyelid surgery is concerned, it really does require a physical exam to determine the indications of going from the outside to the inside. In skilled and experienced hands, either technique is valid. So it's more a matter of what is right for you. So at this point, I would recommend meeting with qualified and experienced cosmetic surgeons. I would also suggest that you meet with people who have a lot of experience with eyelid surgery and can understand the complexities of other procedures necessary to maximize the outcome and to avoid the problems I referred to earlier. And then once you meet and have a sense of what the approach is and you feel confident, move forward. So I hope that was helpful. I wish you the best of luck, and thank you for your question.